Welcome to This Explainer. Today, we're uncovering why a totally curable disease is still spreading.
That disease is leprosy. Surprisingly, the real culprit isn't a lack of medicine, but a lack of time.
Let's investigate these detection delays using a recent public health study out of India as our guide.
Researchers carefully tracked the exact medical pathways of 46 newly diagnosed leprosy patients. It was a chaotic maze. Patients visited an average of 3 different doctors before finally getting a diagnosis.
Now for the big reveal. How long did this messy process actually take for these folks?
A staggering 108 days. That's the median wait from the very first symptom to finally getting treatment.
During this wait, the disease spreads and causes irreversible nerve damage. So, who's actually to blame?
We can split the blame. There's a 73-day patient delay and a 14.5-day healthcare system delay.
First up, the patient delay. It took an average of 73 days just to seek help.
Why? Because early signs like numb skin patches are often just mistaken for harmless winter dryness. But the darkest reason for this delay is the heavy toll of intense social stigma and fear.
Patients reported being treated like outcasts, even in their own homes, which completely stops them from speaking up.
Moving to the system delay, what happens after they finally get the courage to see a doctor?
Well, that delay is heavily influenced by exactly where the patient chooses to go first.
Private clinics had a 28-day delay, double that of public clinics. This was largely due to missed signs.
Many private, informal doctors just aren't trained to spot leprosy. They offer dangerous false reassurance instead.
Even when referred correctly, patients travel up to 50 kilometers repeatedly. This travel burden causes huge delays.
We have the data and we know the roadblocks. So what's the path to zero?
The study outlines 2 steps: educate communities to erase stigma and specifically train private doctors. Integration is key. We must connect private clinics with public health resources so nobody falls through the cracks. If we close this 108-day gap, we can stop this disease for good. Are we ready?